I'm not a criminal.
You just need your father's name.
He's looking for me. He supposedly leaned up and got sober. He wants to be part of my life again. If I ever see my dad again, I'll kill him. What's happening to me?
So the abuse is real, but the name is not. Surely they would have found this out when they checked his health insurance when he was admitted. Isn't that what Americans do? In England, we just make sure you have a postcode and a passport. I promise that wasn't a dig. Very excited to be reacting to House MD Season 7, Episode 17, Fall from Grace. On this channel, we are reacting to all 177 House videos, and this will be episode 149. Let's see if we can get the diagnosis before House does as a doctor working in London.
Go for launch. 5, 4. My father's gonna kill me. You gonna be okay, mister?
It smells like licorice.
First person to offer me an interesting case gets to ride her.
He said his burning flesh smelled like licorice and the ER and septic's like blueberry muffins.
Smells like a winner. Let's go check out the park where they found him. Load him up with prednisone, give him an odor ID test. I want you to meet Dominica. We're getting married on Friday.
I don't think that two people are supposed
Live it on the edge, baby doll.
What about those scars and burn marks?
My dad. We didn't exactly get along when I was a kid.
You can't ride that thing in here.
New Jersey handicap ordinances.
They apply to wheelchairs and powered scooters only.
I'll return it.
I'll make an exception for your leg.
A very soft-looking man. Must be the field zone.
You're trying to screw with Cuddy.
Dominica needs a green card. She's willing to work 4 days a week for free. It's gonna save me about $33,000. Your stunned look, I take it, is your way of saying, brilliant idea, House.
We need you to tell us what you smell.
Rotting meat,
It's baby powder.
What kind of drugs you shooting up?
vitamin supplements. I think I should check out now, and I should.
Gastrointestinal bleeding.
Whoa, this aged very badly. We didn't realize at this point the smelling rotting flesh is actually probably safer than baby powder since talc can be contaminated with asbestos. More on that in another video, but for now our patient has pressing issues of Valentine roses smelling like sluice and Erde junkyard being fresher than sandalwood. So what can do that and have his bowels reverse vomit up some crimson ectoplasm? Well, the smell thing is called dysosmia, and it is smelling one thing as another, which is a completely different system to the bowel. That means whatever this is must be multisystemic. One potential cause is inflammatory bowel disease, where your immune system attacks your own bowel, but the symptoms may not be limited there. It can present with rashes, joint pain, and even blurred vision, although even though it's possible, what probably isn't on the common symptom list for that is smelling leeches for lavender. Another potential cause could be syphilis. The episode is called Fall from Grace. Maybe he was shunned by the church for his sexual habits, and that can cause ulcers in the GI tract as well as odd smells. Oh, that actually fits the story very well. How does the drug use fit in though? Maybe they are actually vitamins, and that shows he has a weak immune system, making syphilis even more likely. Alright, I'm going for syphilis as my first diagnostic guess. Let's get more clues.
Is anyone else disturbed by this? Tests confirmed they were vitamin A and B12.
Well, kid's a junkie.
Tox screens were negative for drug use.
His hair wasn't. I had it tested.
If he has a history of snorting heroin, he could have caused a dysosmia himself.
And the bleeding in his GI tract.
Vitamin injections could have caused that.
Give him tocopherol and zinc supplements for the excess vitamin A.
Your blood test was clean, but your hair showed heroin use.
I've been clean over 3 months now. I OD'd back in November, and they said I was clinically dead for several minutes. I should be dead, but I'm not. My goal is to become a doctor one day.
We found 13 masses spread across the wall of his colon.
Can't be tumors, edges are too sharp and defined.
Could be looking at fungal masses hanging off the walls of his colon. Run a scope up where the sun don't shine.
I think we should boycott this wedding on principle.
That's definitely not a fungus. You were bleeding because you had 13 pieces of bone in your digestive tract.
I kind of volunteered to eat them. There's this great Italian restaurant I like to frequent. Their dumpster out back. And the cook is kind of a friend of mine. And he challenges me to eat stuff.
Great friend.
I think there's something wrong with my eyes. It's like I'm looking at you from the bottom of a well.
If we add tunnel vision to the dysosmia, we can subtract the bone-induced abdominal bleeding.
The symptoms fit for Western equine encephalitis.
No, fever. He could have a meningioma or plasmacytoma. Affects his sense of smell, and now it's growing and pressing on his optic nerve. Find it.
Well, my dad used to lock me in a closet, and it feels like I can't breathe.
He's vomiting. He has 2 dark spots in the parietal cortex.
Who shoots up vitamins? No wonder he's got 2 dark spots on his parietal cortex. He should name them Spot A and B12. I'm glad he's not real, otherwise I'd feel bad for joking about a guy whose dad locked him in the closet. I'm definitely going to hell. The patient's life will become a living hell though if we don't crack this chicken bone case though. So what do we know so far? He had the masses in the bowel, which we now think are because of his eating habits, dark spots on the brain, and still the abnormal smells. If I pause on the scan, those dark spots do seem to be in the parietal lobe, which is pretty accurate. They're also fairly small, about 2 to 3 millimeters, with a smooth outline, although not exactly circular. Either way, it doesn't seem like a malignant tumor, and those spots wouldn't cause the smell changes, which would be more associated with the olfactory nerve at the front of the brain rather than the back. I mean, he could fairly easily have given himself an infection from his shooting up, and he said he wanted to boost his immunity. Maybe he has a condition that's suppressing his immune response, which means he has an infection, but it isn't showing the classic signs because his immunity is ironically shot. Severe combined immunodeficiency, Wiskott-Aldrich syndrome, or X-linked agammaglobulinemia could do it. He did give us a clue before by saying that he actually didn't get taken to hospital when he was younger and had an abusive father, which meant that even though these would have been picked up usually as a kid, they could have been missed in his case. That actually works really well here with both the story and the medical side. Alright, I'm going for infectious encephalitis as a result of congenital immunodeficiency as my second diagnostic guess. Let's get more clues.
The dysosmia and tunnel vision could be hallucinations.
Did you know that she's
dying of guilt and feels horrible for dumping me.
You're pummeling an opponent who isn't fighting back.
Oh, my arm really hurts.
It feels like it's on fire. No, not that one, this one.
Ahoy there, me hearties! Permission to come aboard!
Sounds like regional pain syndrome. Has to be a genetic disorder.
Hey, if you let us out, we can start testing.
Since it's genetic, daddy or mommy's got it too.
Doesn't know where his mother is, and he won't tell us where his father is.
You telling me that you 4 geniuses can't outwit him?
I found Danny's father. Chase and Masters are already on their way. Why didn't you ask me to be part of your wedding? Is it that you really don't like me?
Oh my God! What do you think she was doing?
Oh, I feel sorry for the little one. Isn't there something we can do?
We need to talk to you about your son, Danny. Yeah, we just want to know if there's any diagnosed genetic disease in your family.
We're trying to make your son better.
We buried him 3 months ago.
Who are you?
The important question is, who are you? Oh, you are not Danny Jennings. So why don't you cut the crap and tell me your real name?
No.
Either you're a criminal or a superhero.
I'm not a criminal.
I just need your father's name.
He's looking for me. He supposedly leaned up and got sober. He wants to be part of my life again. If I ever see my dad again, I'll kill him. What's happening to me?
So the abuse is real, but the name is not. Surely they would have found this out when they checked his health insurance when he was admitted. Isn't that what Americans do? In England, we just make sure you have a postcode and a passport. I promise that wasn't a dig. Our patient needs to be dug out of his situation though, as he is now not able to coordinate his hand reaching the cup. That could be a few things, but most likely represents something called ataxia, which is where the little brain known as the cerebellum that coordinates your movements is damaged in some way, leading to the missed grab. So adding cerebellar ataxia to tunnel vision and funny smells, what does that make? Well, I want to say MS, but that doesn't really fit the whole backstory of the abused child who could have something missed from hospitals. Tumors don't really fit the black spots on the scans that we said as well. There are multiple neural pathways involved, to be honest. Whoa, okay. Wait a minute, what if the patient was giving himself the right treatment this whole time? Oh, that would be hilarious. The solution is right in those powders that he found. B12 deficiency due to something called pernicious anemia. It could have presented younger but was missed and now has gotten so bad that it caused neural degeneration. The solution would simply be B12 injections, and in all fairness it could explain everything. So he was treating himself outside of hospital and now he's here, he's getting worse. Fun fact, we usually get B12 from eating meat and animal products, so vegans get this a lot when they don't take supplements to boost their levels. Wow, that would be genius from the writers. All right, I'm going for B12 deficiency as my third and final diagnostic guess. We are locked in.
Did you find out his real name?
Cerebellar ataxia, early onset Parkinson's. We give him levodopa, confirmed with DNA tests.
He's gone too far. He's taking up 6 handicapped spaces with a monster truck. You're the first boss he's ever had who can handle him. He needs someone to say no. Start kicking him where he needs kicking.
This room is for patients' families, not for doctors trying to defraud the government.
I sent out the invitations.
That's also not my problem.
Just let me die. Because I've done things, horrible things. I've hurt people. I thought God forgave me. He just wanted me to suffer.
You don't deserve it.
I had a girlfriend in college, and I almost killed her. I started hitting her. I'm evil. I feel dizzy.
We need a crash cart in here. His heart is dilated and failing.
What are we missing?
That he's gotten worse since we admitted him.
Why? What's different here than, say, living in a filthy state park?
You think cleanliness is making him sick?
He's eating healthy because he can. Most of the meals in here are vegetarian. Adult Refsum disease. His body can't process the phytanic acid and chlorophyll. Run him through a plasmapheresis treatment to remove the excess phytanic acid from his blood. Okay, I gotta go get married.
Do you, Dominika Petrova, take this man to be your lawfully wedded husband?
I do.
Wedded wife. Now pronounce you man and wife.
I'm just angry at myself. Promised I wouldn't let this get to me.
So all I have to do is eat the right kinds of food and I'll be okay? I think God really does have a plan for me.
I know this is not the real marriage, but I really like you.
I can't. I never sleep with married women.
Danny's DNA. When we sent it to the lab for testing, it sent off alarm bells. He's a serial killer who eats his victims.
And we saved him.
Now, if that doesn't break Master's faith in humanity, then I don't know what will. That is wild. If they've just done genetic tests earlier, man, oh man. I mean, that is pretty disturbing considering the reason why he got unwell in hospital was because he started eating vegetables. Oh, wild. Oh, and there I was, wide-eyed and bushy-tailed after hearing the vegetable thing that it was going to be B12 deficiency all along. How naive of me. Adult Refsum disease, quite literally a 1 in a million diagnosis, usually genetic and extremely difficult to diagnose. That means the tunnel vision was because of something associated with that called retinitis pigmentosa, which they would have seen had they looked at the back of the eye. Pretty accurate though in terms of the strange symptoms, although it's usually a lack of smell rather than a change in smell sensation. I'm very interested in what happens with the House Cuddy situation here too, as it seems like Cuddy has just had enough, even though it's clear House still wants them to be together. I mean, imagine declining sex with your own wife on your wedding night, and the reason is I don't sleep with married women. Give those writers a raise. Fantastic episode. 8.4 out of 10 entertainment. 8 out of 10 accuracy and 8.4 out of 10 diagnosis. This episode doesn't make full sense until you watch the previous one where House is in heartbreak crisis right here.